at MatchMd's headquarters in Miamisburg, Ohio, with Basil, a co-founder of MatchMD, which is a pioneering physician communication system. Basil is the president and CEO of MatchMD and presented at the inaugural AHIS Innovation Theatre in September. First of all, thanks so much for having us here at MatchMD and showing us your facilities here, which are lovely. And you clarified, I want to start out by saying that MatchMD is not a dating service for physicians.
Exactly. Match came after. So we need to talk to them about the copyright.
Right. So can you tell me, kind of in your own words, to tell our audience, what problem does MatchMD address?
Yes. Thank you so much. I'm very excited to have you here. Thank you so much. And talking about MatchMD, when we started back in 2000, what we had doctors that take call at night, and that they used alpha pagers, or actually numeric pagers, where you would send them a message. A nurse would try to get hold of a doctor. They'll pick up the phone, they dial that number for the pager, and they put a number to call back. That's it. So 513-1234. That's it. So the doctor had to stay home next to his home phone. We didn't have cell phones at the time. Also, if you have a group that has multiple doctors, to know who's on call, the nurse needed to look up papers and then say, okay, where's this group? Let's see what kind of specialty cardiologist. This is the doctor I need to get hold of. Is he working tonight or not? So that all was paper-based. And in addition, when you send that numeric page to get hold of the doctor, so he can call back and you can explain to him what's going on with the patient, is one time. So if he's driving, if he's at home, no signal, it's a one time. So you send that number, and if it doesn't reach him, you're out of luck. You wait, and there's that delay in communication. Then you have to find alternate ways to get hold of the doctor, maybe call him directly at home. So what we did, at that time, there were alphanumeric pages that came up. There were flip pagers that they had the technology, this is before cell phones, where they had to type a message. We provided them with a tool, a cloud-based software, where they log into our website and have the nurses type a message. That message will get to the pager, the alphanumeric pager of the doctor, and in there, he can type a reply saying, I read it, okay, I'm sending this back, here's what I'm gonna be doing next. So that helped doctors a lot. And what we did, we provided online call scheduling. You don't have to mess with papers or fax them over to the call center. That was the key selling point for MatchMD from day one.
Yeah. And so what makes this approach so innovative?
If you look at innovation in our product, we really, the internet, was ripe, a lot of web applications. Before they were standalone desktop applications, then the cloud-based applications started to emerge in the market. So in that, we were the pioneers into doing that. So providing the online call schedule where you can assign someone from your office to log into your website under MatchMD and fill in your call schedule, that was innovative at the time. The second thing was two-way pagers. That was a new innovation. They had different brands where we had to, make sure our software works with so many. So in the list that we had at the time, comparing it to now, we had like 10 companies in there that said, okay, do you work with this pager company or that, or Now we only ask them, do you have an Android phone or an iPhone? Right. So you can see the difference. And we improved on this throughout the years. Yeah. Now we have smartphone, which is an excellent tool, to get hold of doctors, be able to care to the patient.
Because it seems now that it's in place, that it seems like an obvious kind of system that should have always been there. But MatchMD was a pioneer of that.
Yes.
Yeah, it's wonderful. So how do you start something like this? You obviously need a network of expertise. How did you go about recruiting those people with the right expertise to make this work?
Yeah, first of all, to launch MatchMD, we had to put a team of experts in here. The experts were divided over so many. Categories. First of all, we had a back end. You have to have servers. You have to have experts in server technology. Make sure our websites are up. Our uptime, for 21 years, we haven't been down like less than 5% of the time. So maintaining that website, it's you have to make sure you have the right team of engineers. How updates, you gotta make sure you can maintain all that and build the back end processes. Then the second thing was the front end. Front end design was important because who are the two main users of our website? They're nurses and operators. So the doctors don't use the website, they're the recipient, they're on the recipient end.
Right.
So nurses had to log in and 1, 2, 3 steps, search for the doctor and type in a message and hit send.
Yeah.
When you hit send, there's tracking of that message, where it's left the server, where it reached the device, where it was read, and then it was delivered and then replied. So all these stages were monitored by the nurse. You gotta give them a visual indication, and we use color coding to make sure. And we had pop-up screens that flash. You could turn that feature on, because nurses could walk away from the station and they can look at the system and they see a green flashing light. That means the doctor got the message.
Oh, okay.
They didn't have to walk back to the station. So all these techniques, we needed experts in that. And that, for our luck, is some of our founders, co-founders with us, were doctors and surgeons. So we had the input from them to make sure that we get the right tool. On top of that, I have another team that you have to build, the sales team. So once you build the product, it's like 40%, then you have 60% between marketing and sales. So that was at the time when there was internet usage was low. So imagine the challenges.
Okay. So did you have nurses also giving you input about what's the best way to alert?
Of course. What happened when we started with a product for stroke care. And we were interviewed, and even for a TV station, local TV station, where we saved lives. Stroke care coordinators, they're previous nurses. So what they do, they assemble a team of different specialties in order to answer for stroke patients as they're walking into an ER. It's so confusing for nurses to recognize if this is a stroke patient or not. So we help them create a protocol where they use the MatchMD system on a 2-step approach to taking care of the stroke patient. As they walk in, they send out a first alert using MatchMD saying, we've got a potential stroke, and the neurologist is the first one that is paged. At the same time the neurologist is paged, the surgeon, the neurosurgeon is paged, the pharmacist is paged. All the different departments are paged using the MatchMD as a whole team. So we had input from them, and we were able to save lives, doing so. Because if the neurologist comes and confirms, it's a thumbs up, then a second page goes out, it's a confirmed stroke, the pharmacist is already aware of what's going on, and he'll have the TPA or whatever medication ready to give to the patient.
Because the TPA takes about half an hour.
Exactly, and you have limited time with stroke patients.
Of course,
very proud of that.
time is brain.
Exactly.
I used to be in the Northern Kentucky, Cincinnati area stroke team.
Oh,
that
great,
was
so
my
you know
research.
exactly. Great.
I didn't realize it was MatchMD that we used, but I used to
Yeah.
work in that research area, so it's wonderful, Were there any barriers to successful launch? I mean, was there competition? Was there anything that kind of...
The hardest thing we were hit with is that we were all professionals. We were trying to do this as a proof of concept, see where it's going to go. And all of us had other professions, in the daytime. So the challenge was to do it at nighttime with the minimum cost, The investors at the time, you're talking about 2000, we're still fresh out of, the big, problem we had before that with the .coms. And, we're trying to build this product, and trying to get the investment was hard. So we had to work around that. But we were successful in bringing some angel investors that helped us. Very appreciative of that.
Oh yeah, those are always good, angels.
Exactly, they come and save you.
So I know, having worked with physicians for many years, that the medical community can be very resistant to change and adopting new technologies until they're absolutely proven, but you need to prove them first, so it's kind of a vicious cycle. So did you have any resistance from the medical community?
Oh, we had big resistance from the medical. I mean, talking about doctors that walk into a clinic, at the time, they didn't have to interact with computers to check the patient in. I mean, you had the front staff, exactly. They didn't want to see a computer. They would just come in and do the physical exam and prescribing medications by hand. So before EMRs, I mean, we were probably launched at the same time some of the early adoption of EMRs, electronic medical records. So for us to have the doctor say, okay, we're going to give you this pager now, you can type on it, it was a big shock. I mean, especially for the doctors that are used to stay at home and not answer, outside the house. But so once they got used to the system, it was a big sell for us. I mean, the convenience is freeing them from leaving the house, and not having to stand by a payphone and be able to reply to a nurse. That was a big advantage.
Sure. Yeah. So what was the impact of COVID? I mean, you mentioned it a few times that COVID might impact this use of MatchMD or participation of providers. Did it have a big impact on you?
Being a communication tool at the time where someone can work remotely is a big advantage for us. We actually never slowed down. Our volume went up. One of the facilities here, local hospitals in town, I mean, their volume was up to 200,000 messages per month using our tool at 9 facilities. So you can imagine the traffic.
Yeah.
I mean, it is amazing. You know, during this time we were able to provide help, you know, for people that are working remotely.
Yeah.
So we were right there along with the telehealth software, with the electronic medical, you know, records. You know, we were right there to help them and support them in the communication, to cover the communication part.
Right.
So that was a big advantage for us during the COVID.
Well, I'm glad that you did well during that time. A lot of
Thank
people
you.
struggled, I think.
Thank you.
So you started out more than 20 years ago, as you've intimated, and now you serve clients all the way across the USA, including Texas and several other states. So are you having plans to go global?
Yes, we are in 10 states right now and expanding and growing. We have an opportunity, you know, that came up overseas through the HIMSS conference. It's in Las Vegas 2 months ago, and we pursued it, and it seems to be fruitful right now for the MENA region, Middle East, North Africa region.
Right.
And that's, you know, based on demand over there. We noticed that they're using, you know, social media apps that are open platform, not secure, to do, you know, ordering for medications for patients, so forth. So we really wanted to give them the same standards that the US has, like a HIPAA compliant software where they can use to provide care with the search and retrieval of old records. So that was a big advantage, and it's fruitful. Now we're opening our first regional office over there. We're excited about that. So hopefully within 3 months we'll have an office registered there and ready to do business.
Where is that going to be, in Jordan?
It's going to be in Saudi Arabia.
Saudi Arabia. So yeah, I mean, our IHCI has a lot of links with Saudi Arabia as well, and it's a market that's very interested in improving digital technologies and AI and medical care and innovations. So
Yes, I
you
agree.
can see how that would work. So do you think MatchMD is really, I mean, it's obvious that it has, as serving top quality healthcare to underserved communities, how has it helped address inequities in healthcare access?
For underserved communities and people living in rural areas, I mean, we're talking about right now working with 2 different large networks of home health providers. The home health provider nursing, it's a model that started with COVID.
Yes.
You know, where you had people that you need to attend to at their house. So that's a big booming business at this time, and it's growing like every day exponentially.
Yeah.
So what we're doing, we're providing tools for these nurses to use MatchMD in case they need to communicate back to the doctor in a secure fashion. I mean, at the time when COVID started, you know, they a little bit eased off on the HIPAA compliance issue, but we really wanted them to use it more and keep the patient information, you know, confidential. So we're providing these nurses with communication. Not only that, is building teams. You know, when you have caregivers teams, they can consult with each other. That's the best tool that they can have. It's an MatchMD.
Absolutely, yeah. Then the doctor doesn't have to go around and see everybody. They can
Exactly.
coordinate care from another level. That's great. So what would you like to communicate to our readers about your journey creating MatchMD? Is there anything else you'd like to tell us that I haven't asked specific questions about so far?
One of the key things that we emphasize at MatchMD is that we want to save lives. You know, the patient is where we want to make sure that, you know, if there's a lab result that the doctor needs to see at midnight about a patient, you know, they need to see that result immediately. That's where key communication is, you know, is key. I mean, it's important for us to give the right tool for the nurses to let the doctor know, not going through a third party or a call center. So the direct access between the nurse and the doctor without having a third party is key. The other thing we noticed, just like last week's unfortunate tragedy in Houston, where, you know, the providers, and this is something that I read yesterday on CNN, that communication was a big failure. The people that are inside the concert, organizers, they did not communicate properly with the first responders outside, you know, the astral world. So they did not give them radio frequency tools. They only gave them cell phone numbers, you know. For the care providers, how many calls can someone take? It's only 1 call at a time. But if they had a tool like MatchMD, you know, how many messages? They can get so many messages and look at and prioritize which message to follow up on. So that's where, you know, we thought about this, and you know, we talked about this even from the day when we had the tragedy in Dayton, the mass shooting, that we really need a tool to organize everyone's effort. Let's say you have a patient en route. You don't know which facility to take him to, especially when you have so many victims. You know, that's why we thought about a new product we're launching soon. Actually, we just doing a beta right now. It's called Emergency. It's powered by MatchMD. We're excited to announce that, and this is a good opportunity for us.
Well, thank you. Yeah, that sounds exciting. I'm sure we'll be covering that in the future as well.
Great.
So we're going to have your contact information in the article, and what's the best way for interested readers or even people who want to participate in MatchMD to contact you?
We have our contact form on our website. We have like a local number and a toll-free number, and we have emails in there. So anyway, communication. We're in Miamisburg, Ohio, and I would love to serve more of the Cincinnati region where you guys from. And
Let's spread the word.
Yeah. Thank you
Okay.
so much.
Well, thank you so much. It was exciting seeing the talk at Innovation Theatre. Hopefully you can participate again next year with the emergency.
Looking forward.
Yeah, that would be fantastic. So, thanks so much for having us.
Thank you.
Bye.
Thank you all.